Hello, parents. This is Dr. Pettinger at Grace Christian School. I'm coming to you today with some important information about the novel coronavirus. I know we have all heard a great deal about this on social media and in the news, and unfortunately, we've been getting some conflicting stories. So this morning, I reached out to the Orange County Department of Health to get factual information straight from a source who would know. According to them, there has only been one reported case in all of Orange County. This person has been identified and is currently being treated. It is a male in his 50s. That is all the information that they are releasing. And the reason for that is in getting information from them, they have been in contact with the Center for Disease Control in Atlanta, Georgia, that they have not found any cases in the United States that have been spread person to person. And because of that is the reason they are not putting out travel alerts as to where potential victims have traveled and been, because they do not believe that is how the disease has been spread to this point in the United States. Some other helpful information they have given is, according to Dr. Quick, the best way we can safeguard ourselves and our students is by following normal flu cold procedures. The first thing they recommend is washing your hands often with water and soap, not just a cursory pass of your hands under a faucet, but getting your hands wet, actually lathering up thoroughly and thoroughly rinsing and drying your hands, and using a paper towel when you exit a restaurant, exit a restroom, not a restaurant, a restroom, and turning off the faucet. This way it prevents the spread of any potential disease. The next thing they talked about was making sure that you cough into your shoulder or sneeze into your shoulder. This prevents disease or particles from being spread out into the air and becoming airborne. Other things that they did point out was they recommended that people get the flu shot, and that's an individual decision each family needs to make on their own. Some other points that we started talking about was masks and how useful are the masks. They said the normal mask that we're seeing people is this surgical mask right here that you see a lot of people wearing. While this is useful in some situations, it doesn't knock out all the particulates. The next level up is this type of mask, a sanding mask that you would see, that has a band over the top, and it has a rubber band in the back that goes over your head, elastic. And finally, the mask that they would be recommending for the novel coronavirus is this. It's an N95 mask. It comes in different shapes and sizes. Some have a respirator right here in front, a little nozzle, and this is the best. But with this being said, these masks are only useful if they are used correctly. And that means a one-time use. Once you've used the mask and you take it off, you need to replace the mask, because you are then allowing particulates to get into the inside that you would be putting next to your face and creating moisture, which could also increase the chance of something getting you sick. The other thing is, if you do not remove the mask correctly, especially with children, it increases the potential of getting sick. Just picture if you have the mask over your head and your child, it's blocking all the particulates, grabs the mask to adjust it or something like that. They're doing something, then they come up and they rub their face like this. Now they've just spread this around their face, or they've rubbed their eyes, because flu and cold particulates can enter the body through the eyelids and enter the system that way. So while these, we see a lot of them and they do help in some situations, used incorrectly, you could actually get yourself sick or allow the disease to be there. So that is information coming directly from the disease control. The N95 they really recommend for healthcare professionals if you really want to block out all the major particulates involved in cold, flu, or the novel coronavirus. So I wanted you to hear that. The next thing is, we do have some short-term students here on campus, and I want to share with you some factual information about that. We only have 4 students on campus from China, and they have been in the country since January 1st. The incubation period for the disease is 15 days. Seeing that all of these students have been in the United States for longer than 15 days, they have not distributed or shown any signs of the disease. Another important fact is the province in China that only 4 of these students are from China, came from, is 1,200 kilometers away from the outbreak point, which is 700 and about 40 to 50 miles away, which would be the distance from here to El Paso, Texas. So we're pretty safe. The majority of our students on campus for this stay over the winter stay are from Korea. And Korea has less identified cases of this virus than California does. So I believe we're doing a great job there. In addition, what are we doing? We're keeping the classrooms clean. We're going in and cleaning our restrooms like we always do. We sanitize and we make sure that we have great hygiene throughout the campus, and that's what we do. What can you do? You play a major role in helping us prevent the spread of this disease, cold, and flus. And what is that? It's keeping your child home if they have a fever or if they've thrown up or vomited in any way. They have to be fever free for at least 24 hours before sending them to school and at least 24 hours after the last time they threw up. In addition, I know this sounds kind of graphic, but if they have any type of green mucus, which means the child has an infection, they should remain home. I know this is extremely tough with working parents, and it's hard to take a day off work to stay home with your child, but this is the best way that you can help stop the spread of any type of cold or flu here at school or at your workplace. These are great rules for not only our students, but they are actually followed by all of our staff members. If any of our staff members show any type of cold or flu symptoms that fall into this, they are told to stay home because we do not want them getting sicker or spreading any kind of disease with our students. Your child's health is always our number one priority here at Grace Christian School. We will continue to stay abreast of information that Orange County Department of Health is putting out, as well as the Center for Disease Control. We wanted to provide this video for you to separate fact from fiction that you might be reading on social media and provide you with the facts that we firsthand received from the Orange County Department of Health. Working together, we will keep our kids safe and healthy through this flu season and help keep them away from the Norvell coronavirus. Thank you, parents, for listening. Have a wonderful day.